Janet Jackson surprised her fans yesterday with the announcement that she was stopping her Unbreakable world tour. The singer cited a, quote, sudden change, end quote, in her plans for a family, hinting perhaps at a possible pregnancy. Now, if true, that would mean the pop icon would welcome a child in her early 50s. Dr. Devi Nampiaparampil is an associate professor at NYU School of Medicine, good enough to join me now to discuss many things, including now this idea of midlife pregnancy. It might stop people, Dr. Devi, here in their tracks when they hear it initially. How likely is it to be pregnant after the age of 40?
Well, it's much less likely than if you're 20, right? So it's about 10% for someone who is 40 years old. It's about 20% for someone who's 20. So that's actually surprising to a lot of people. It's not 100%. So humans are not that efficient at actually reproducing, and then that success rate goes down as you get older. Now, of course, with intervention, so fertility specialists, some of the treatments that we have, that percentage goes up quite a bit. But by age 40, it is much harder, and by 45, it's even less than 5%.
What are the risks associated with getting pregnant later in life?
So there are a few different risks. So first of all, the actual chance of getting pregnant is much harder, right? But if you actually do get pregnant, then the chance of miscarriage goes up for a few different reasons. First of all, women might be more likely to have fibroids or other structural abnormalities in the uterus, and then that can cause a miscarriage. Sometimes because the eggs have deteriorated over time, over the course of a woman's life. Then sometimes the egg that actually created the embryo may have other genetic defects or chromosomal problems, so that can be another cause for miscarriage.
And that develops over one's lifetime.
Over a lifetime.
So essentially the eggs begin to break down?
Exactly. So if they break down, the ones that you're left with may have other problems, potentially genetic defects. So that's why we see things like Downs, for example, a little bit more. But most of the genetic defects are chromosomal problems, so problems with the DNA. They actually result in miscarriage. So you might not actually see a live birth from them. And then, of course, as women get older, they develop other medical problems, right? So you might have more women with diabetes, more women with high blood pressure, and that can lead to complications both for the mother and for the baby.
Concentric circles of complication.
Exactly.
Really. You know, we mentioned Janet Jackson now stops down a tour. Obviously, that is a high energy, most really daily thing that she is doing. We've seen it in other celebrities, if you will, Halle Berry, Mariah Carey, Kelly Preston. But in Janet Jackson's case, again, this is a woman who is getting after it physically. What impact would that have on it, positively or negatively?
Well, there could be a little bit of both. So the fact that she has had a high impact or very physically active sort of lifestyle for a long time, you know, those things would put her maybe in better shape generally. So she may not have as many risk factors for high blood pressure or the other things that we worry about as people get older. But at the same time, if you're already pregnant and then you have this high impact lifestyle, I mean, there are some problems usually later in the pregnancy. So think about when you exercise, right? If you're doing something called isometrics, so things where you're trying to hold a position, you might hold your breath, right? Or you run out of air, you feel like you're getting a little bit breathless. Well, when that happens to you, if you're pregnant, that happens to the baby also. So that can cause some problems. But I think in terms of if this is because of a pregnancy and she's canceled the tour, I mean, the other reason is because, well, you can have problems if you're traveling a lot, let's say on tour, right? So your risk of blood clot is higher if you're pregnant. Your risk of complications is a little bit higher, so then generally you might want to be close to a hospital or your own OB-GYN, especially there are specialists for these high-risk cases where you're pregnant when you're older, so you may not want to be halfway across the world if something potentially happens.
Makes sense. A conditional and cautious mazel tov, perhaps,
yes.
to Janet Jackson.